You see that logo everywhere, right? The World Health Organization's snake and staff wrapped around the globe.
The rod of Asclepius.
Exactly. It looks so clear, so unified. But behind that symbol, the reality of running the world's biggest global health body is, well, it's messy. It's complicated.
It really is, and it's built on this foundation of just massive ambition. I mean, the WHO, it's a specialized agency of the UN.
Right.
And its constitutional goal isn't just about stopping sickness. They define health as, get this, a state of complete physical, mental, and social well-being.
And not merely the absence of disease or infirmity. Yeah, I read that. That is incredibly broad, hugely ambitious.
It sets the bar incredibly high.
So that's our mission for you today. We're doing a deep dive into the WHO. We want to unpack its history, look at some really world-changing achievements.
Oh, definitely some huge wins.
But also get into the tough stuff. The political pressures, the money questions, the things shaping where it's headed right now. We're going to connect the dots basically from like 19th century cholera concerns all the way to today's diplomatic rows.
And I'll try to help synthesize that huge range of work for you, because they're involved in everything from digital health policy to coordinating emergency responses on the ground.
It's a massive portfolio.
It is. And it often feels like a constant struggle for the organization to actually live up to that foundational promise of health for all.
Okay, so let's unpack this right from the start. The WHO officially came into being in 1948.
That's when it formally launched, yes. But its roots, its conceptual DNA, well, that goes back way further. Nearly a century earlier, actually.
You mean the International Sanitary Conference?
Exactly, the ISC. The very first one was back in 1851 in Paris.
Wow. Okay.
And these conferences, they weren't about grand ideals initially. They were purely practical, born out of necessity, trying to stop killer diseases like cholera from spreading along shipping and trade routes.
Which makes sense. That's how epidemics traveled. But what's really telling, I think, is how hard it was for them to agree on anything.
Oh, absolutely. Even when faced with, deadly shared threats, getting sovereign nations to sign on to binding rules was incredibly difficult, a real lesson in international relations right from the start.
How long did it take?
Get this. It took 41 years. 41 years and 7 different conferences before they finally reached their first multi-country agreement.
41 years for one agreement.
Yep. That was in Versailles, 1892, and it was laser-focused on just one thing. Basically, the sanitary control of ships passing through the Suez Canal to stop cholera.
That's specific.
Very specific, because that was a major choke point for disease transmission.
So 41 years for one narrow convention. You look at today's fights over WHO funding or, membership withdrawals, and it kind of puts it in perspective.
It does. The core challenge hasn't really changed. Getting independent countries to consistently cooperate for the collective good, it's always been tough.
So fast forward to the post-World War II era. How did the WHO formalize things when it took over?
Well, the WHO Constitution was signed in 1946. Then it formally came into force on the first World Health Day, April 7th, 1948.
Okay.
And crucially, it wasn't starting from scratch. It integrated the existing structures, the money, the people from earlier bodies, specifically the League of Nations Health Organization and another group, the Office International d'Hygiène Publique, or OIHP.
And that inheritance was really important, wasn't it? Because it meant they got the system for tracking diseases?
Exactly. They absorbed the International Classification of Diseases, the ICD. This is absolutely fundamental.
Well, why so fundamental?
Because the ICD is how the entire world agrees on what to call different illnesses, injuries, causes of death. It standardizes everything. Without it, you couldn't compare health data between London and Lagos or allocate resources effectively. It would be chaos.
It's like the hidden operating system for global health data.
That's a great way to put it, yeah.
So they had this system, they inherited some structure, they held their first meeting in 1948, got a budget, $5 million for 1949?
That's right, $5 million. Peanuts by today's standards, but a start.
So what did they decide to tackle first? What were the initial priorities?
They focused on immediate, widespread threats, things like malaria, tuberculosis, STIs, and also improving maternal and child health. basic survival stuff, really.
Practical first steps.
Yeah, these early focus campaigns kind of set the template, you could argue, for what became arguably their biggest triumph later on.
Right, let's move into part 2 then. Because amidst all the bureaucracy and politics, you have to acknowledge the massive wins. The WHO has genuinely spearheaded some incredible public health achievements.
Absolutely. And the undisputed heavyweight champion of those achievements has to be smallpox eradication.
The only human disease ever wiped out completely.
Exactly. The global campaign really ramped up around 1967. It involved incredible coordination, mass vaccination drives, intense surveillance to find every last case.
And the result?
Officially declared eradicated in 1979. Just think about the first disease in all of human history to be eliminated entirely by human effort. It's staggering.
It really is.
Yeah.
And it fundamentally changed how we thought about what was possible in public health, right?
Yeah.
Like, okay, if we can do that.
Precisely. It gave birth to that optimism, that template, which led directly to the next big push. The Global Polio Eradication Initiative launched in 1988.
Still ongoing. Massive progress.
Huge progress. The WHO's coordination role has been absolutely central there. They've managed to get vaccines into incredibly difficult places, navigating wars, mistrust, leading to a 99% reduction in polio cases globally.
99%.
It's a testament not just to the vaccine itself, but to the sheer logistical effort, the surveillance, the diplomacy required to get political buy-in across so many different countries and health systems.
So eradication campaigns are the big headlines, but the WHO's work goes way beyond just fighting infectious diseases, right? They set the standards for, well, almost everything in health.
That's a huge part of their role, setting international norms and standards. We mentioned the ICD for classifying diseases. But they also introduced the first essential medicines list back in 1977, basically saying these are the core, most effective drugs that every health system should have access to.
That's powerful. Influences national purchasing, treatment guidelines.
Absolutely. And if you look at how they actually allocate their budget today, it shows just how broad that mandate is. It's not just communicable diseases like HIV, TB, malaria.
Although that's a big chunk.
It is. But they also have huge programs focused on non-communicable diseases, NCDs, like heart disease, cancer, diabetes, mental health.
The sort of lifestyle diseases, although that term is tricky.
Right. The chronic conditions that are now the biggest killers globally. And then there's this massive area of environmental health.
That environmental part really jumped out at me from the source material. The numbers are kind of shocking.
They are stark. The data showed that back in 2012, things like air pollution, unsafe water, chemical exposures, climate change impacts, they were linked to nearly 1 in every 4 deaths globally.
1 in 4. That is enormous.
It is, and it pushes the WHO way beyond just clinics and hospitals. It forces them to look at things like housing, sanitation, air quality, even working conditions, all the things that create health or illness in the first place.
Which connects directly back to that initial, very broad definition of health. We talk about physical, mental, and social well-being.
Exactly. It requires that holistic view. But these areas, the social and environmental determinants, they're often the hardest to fund and the slowest to show results.
Okay, here's a perfect example connecting that big policy work to something really specific and current. A guideline from January 2025 on using lower sodium salt substitutes.
Ah, yes, the SALT guidance. This is a prime example of their role in translating global scientific consensus into practical advice for countries and individuals.
So what does it actually recommend?
Well, it strongly recommends that adults cut their sodium intake that's regular salt down to less than 2 grams per day.
2 grams. Okay, that's quite low.
It is, compared to typical diets. And then it conditionally recommends replacing your regular table salt with these lower sodium substitutes that contain potassium instead.
Conditionally, what does that mean?
It means it's a generally good idea for most people, but there are exceptions. They're careful to point out exclusions like it's not recommended for people with kidney problems who might struggle to process extra potassium, or for pregnant women or young children, without specific medical advice.
So it's nuanced. It's not just a blanket, do this.
Right. It reflects careful assessment of the evidence for the general population, while acknowledging specific groups need different advice. That's good public health guidance, taking complex global research and distilling it into something actionable.
Whether it's vaccines or salt intake.
Exactly. That ability to set the evidence-based standard is arguably the WHO's core utility day to day.
But having a great standard is one thing. Implementing it, getting countries to adopt it, making sure people have access to those salt substitutes or essential medicines, that takes resources. It takes governance.
Which brings us neatly to part 3, how the WHO machine actually works, the governance, and, crucially, the funding.
So the top body is the World Health Assembly, the WHA. That's all 194 member states together.
That's right. The WHA is the ultimate decision-making body. They meet annually, they set the policies, they approve the budget, and they elect the Director General. Currently, that's Dr. Tedros Adhanom Ghebreyesus, serving a 5-year term.
And the budget they approve, what are we talking about size-wise?
For the current 2-year period, 2024-2025, the budget is set at $6.83 billion US dollars.
6.8 billion. Okay, how does that money actually come in? Where does it come from?
It's basically a 2-track system. First, you have what are called assessed contributions.
Those are like the membership dues.
Exactly. Compulsory payments from member states, calculated based on their national wealth and population size. Predictable core funding.
Okay, that sounds straightforward enough. What's the second track?
That's the voluntary contributions. And this is where things get, well, much more complex and, frankly, controversial sometimes.
Why is that?
Because voluntary funds come from member states choosing to give extra money, often for specific projects they care about. Or, and this is key, they come from other partners like philanthropic foundations or other international organizations.
And these voluntary funds are a big part of the budget.
A very big part. In recent years, they've made up the vast majority of the WHO's total funding, sometimes over 80%.
80%. Wow. So the core dues are actually a small fraction.
Relatively small, yes. Which leads to the influence question.
Right. The source material flags this, like the Bill and Melinda Gates Foundation being the largest private contributor in 2024, funding something like 10% of the entire budget.
10% from one non-state actor? That's a huge chunk.
So the concern, or the critique, is that this heavy reliance on voluntary, often earmarked, funding means the WHO's priorities might get skewed.
That's exactly the critique. Does the agenda get driven by the specific interests of the biggest donors, rather than by a neutral assessment of overall global health needs as defined in their broad mandate?
So money flows to high-profile diseases that attract donations.
It's like polio eradication or specific vaccine programs, which are obviously vital.
But maybe at the expense of less glamorous but equally important things, like strengthening basic primary healthcare systems everywhere, or tackling those huge environmental health risks we talked about.
That's the potential danger. Creating these vertical, disease-specific programs that are well-funded, while the horizontal foundations of the health system training doctors and nurses, improving sanitation, building robust surveillance remain under-resourced. It's a constant tension.
Are they aware of this problem internally? Are they trying to fix it?
Oh, definitely. It's been a major point of discussion for years. And there was a significant agreement at the World Health Assembly in 2022.
What do they agree?
They agreed to address this imbalance. The plan is to gradually increase those compulsory assessed contributions, the membership dues, so that they eventually cover 50% of the core budget by the end of the 2020s.
Ah, so rebalancing the scales back towards core, flexible funding.
Exactly. The goal is to give the WHO more predictable resources and more autonomy to allocate funds based on overall global priorities, not just donor preferences.
That seems like a really important structural reform. More flexible money means they can invest in those foundational areas.
That's the idea. Strengthening health systems, pandemic preparedness, tackling NCDs, environmental health, mental health, all the complex long-term challenges that might not attract big voluntary donations, but are crucial for that highest possible level of health for all.
Okay, that makes sense. This whole funding structure debate really comes into sharp focus, doesn't it, when we look at how the WHO handles emergencies. That's our next part, part 4. Emergency response and the political fault lines that always seem to crack open during a crisis.
Emergency response has become a much more central and visible part of the WHO's identity, especially after the criticism they faced over their handling of the 2014 Ebola outbreak in West Africa.
Right, that was seen as too slow, too bureaucratic initially.
There was heavy criticism, yes, and it led to significant reforms within the organization. In 2016, they launched the dedicated World Health Emergencies Program.
What was the main change there? You mentioned earlier this idea of moving from just setting norms to being more operational.
Exactly. Historically, the WHO was primarily seen as a normative agency, setting standards, giving advice, telling countries what they should do.
Okay.
The post-Ebola reforms aimed to make it more operational during crises, meaning being able to actively coordinate response teams on the ground, manage logistics and supply chains, deploy experts quickly. More boots on the ground.
Which obviously requires more resources, faster decision-making, and probably more political navigating.
Absolutely, it's a much more demanding role.
And the main tool they have to signal a major global crisis is the IHR, the International Health Regulations.
Yes, the IHR is key. It's a legally binding agreement among member states. It was significantly revised in 2005, largely in response to SARS.
And what does the IHR allow the WHO Director General to do?
Crucially, it gives the DG the authority to declare a public health emergency of international concern, a PAIC.
The global alarm bell.
Precisely. It's the highest level of alert the WHO can issue. We saw it most significantly with COVID-19, declared a PAIC in January 2020, and finally ended in May 2023.
And there have been others more recently.
Yes, Mpox, previously known as monkeypox, was declared a PAIC in August 2024, though that one was lifted relatively quickly, ending in September 2025.
Okay, so they have the power to declare the emergency. But these emergencies inevitably expose the political tensions that are always lurking under the surface, don't they?
They absolutely do. And nowhere has this been more visible or had more impact than with the position of the United States.
Yeah, the U.S. relationship with the WHO has been, well, a roller coaster seems like an understatement.
It really has. Huge volatility. You had the Trump administration announcing in 2020 that it was halting funding and initiating withdrawal procedures, citing concerns over the WHO's initial COVID-19 response and alleged influence from China.
Then the Biden administration came in and reversed that almost immediately in 2021. Funding restored, withdrawal canceled.
Right, a complete U-turn. But then, following the change in administration after the 2024 election, a new executive order was issued in January 2025, once again initiating the formal withdrawal process for the U.S.
With the actual exit scheduled for January 2026.
That's the timeline laid out. And this isn't just about losing the U.S.'s assessed contributions, which are significant as the largest economy.
It's also about all that voluntary funding the U.S. provides.
Right.
And the diplomatic weight, the expertise.
Exactly. It creates massive uncertainty for the organization's budget, its planning, and its global standing. Long-term health programs become incredibly difficult to manage with that kind of funding whiplash.
And it's not just the U.S. signaling issues. The source material mentions Argentina as well.
That's right. In February 2025, Argentina also announced its intention to withdraw. It just underscores how fragile the consensus can be. Domestic political shifts in key member states can have major repercussions for these global institutions.
It really highlights that fundamental tension. A global health body needing global cooperation, but being utterly dependent on the shifting politics of its individual member states.
Precisely.
And if we're talking about politics intersecting with health, we also have to touch on the status of Taiwan, the Republic of China.
Yes, that's another long-running complex political issue within the WHO. Taiwan participated as an observer under the name Chinese Taipei between 2009 and 2016.
Okay, so they were in the room.
They were in the room, yes. But since 2017, they've been barred from attending the World Health Assembly.
Why the change?
Due to diplomatic pressure from the People's Republic of China, which adheres strictly to the One China policy and views Taiwan as a province, not a separate entity eligible for participation in UN bodies.
And this became a really hot topic during COVID, didn't it?
It did, because Taiwan had a notably successful early response to the pandemic. Many countries, including the U.S., Germany, and others, argued strongly that excluding Taiwan, a democratic territory with a highly advanced public health system from global health discussions, was detrimental to everyone, that it hampered information sharing and coordinated responses.
So it creates this real dilemma for the WHO, doesn't it? Their mandate is universal health for all people.
But as an intergovernmental body made up of member states, they are forced to operate within the political realities and diplomatic frameworks recognized by the majority of those states, even when those political boundaries don't align neatly with public health needs. Disease doesn't respect diplomatic protocol.
So wrapping this all up, thinking about the future, what's the big picture takeaway here?
I think it boils down to that fundamental tension we keep circling back to. You have this organization with an incredibly noble, incredibly ambitious goal. The highest possible level of health for all people, universal well-being, but it exists within and is constrained by the messy realities of international politics and precarious funding models. It's constantly navigating between its lofty ideals and the very real limits imposed by being an agency accountable to 194 different governments, each with its own interests.
An organization that saved countless lives through things like smallpox eradication.
while simultaneously grappling with these existential questions about its funding, its governance, and its political independence.
It's a fascinating contradiction. Before we finish, though, there's one little personnel detail from the sources I found quite interesting, speaks volumes about their internal culture.
Oh, yeah. What's that?
Apparently, the WHO does not recruit cigarette smokers.
Is that right? Makes sense, I suppose.
Yeah, it's directly in line with their own framework convention on tobacco control. Walking the talk, you could say.
That is interesting. A clear policy commitment right there in their hiring.
Okay, so let's end with a final thought for you, the listener, to chew on. Something building on everything we've discussed.
Right. Let's connect back to that funding model and the WHO's original, very broad mandate. Remember, that mandate explicitly includes promoting health by improving things like economic or working conditions and other aspects of environmental hygiene.
These massive foundational issues, things like poverty, inequality, pollution, climate change, the root causes of so much ill health.
Exactly.
Yeah.
They require a long-term investment, flexible funding, and tackling complex systems, not just disease-specific campaigns.
So given that huge mandate, and given the current $6.8 billion budget for 2024-25, which still relies heavily on voluntary, often earmarked donations.
Here's the question. What is the trade-off society makes when the world's premier health organization is so dependent on targeted funding from specific states and powerful non-state actors like large foundations?
What gets potentially left behind?
What aspects of that crucial foundational health work, strengthening health systems for everyone, tackling environmental risks, addressing the social determinants of health like poverty and education, might be inadvertently neglected or underfunded when the money flows mainly towards specific high-profile diseases instead of building that robust base for universal well-being?
That's a really critical question to consider, especially as the WHO navigates its next, undoubtedly complex political chapter, something for all of us to think about.